Hello, my name is Raj. I am part of the obstetrics team here at the Social Service League, MP Shah Hospital Nairobi. Here I am to answer some of your questions with regards to coronavirus and pregnancy. First question, what are the symptoms of coronavirus infection? Usually this infection causes a new onset dry cough and fever. However, if you are not sure, I recommend you call the MP Shah hotline number for more information. If you have any of these symptoms, please ensure that your maternity team is aware of this before you step into hospital. Reason being, we have an alternate flow for patients who have these kinds of symptoms. Therefore, protect yourself and protect all of us. Next question. As a pregnant woman, am I more likely to get the infection? Good question. As we all know, in pregnancy, your immunity reduces, and this is a normal part of the physiology of pregnancy. However, with the information we have currently, pregnant women are no more likely than any other person in the population to be more at risk of getting this infection. Next question. Can COVID-19 affect my baby? So let's start with all stages of pregnancy, the first 12 weeks. It is not true that the coronavirus, from what we know so far, predisposes one to miscarry. For the first 28 weeks, your body as a pregnant woman is strong enough to fight off majority of the infections that you come into contact with. After 28 weeks, you need to be a little more careful with regards to any infections. What we know so far with patients who are pregnant and have had infection with coronavirus, majority of them can go ahead and deliver vaginally. There is a smaller chance that you may have to end up with a cesarean section because baby is not tolerating the labor process very well. This is why during the labor process we would prefer if we keep a continuous ear on the baby's heart rate. What about breastfeeding? Breastfeeding is actually thoroughly supported by our entire team. The reason being, so far with the studies that have been undertaken in pregnant patients who have delivered and have the coronavirus, no virus has been found in breast milk. Therefore, we actually encourage all our mothers to breastfeed the baby as soon as possible. If you do have the virus, we would want to ensure barriers so that your baby is not in a position to get the infection. We would insist you wash your hands with soap and water, of course. We would want you to wash the instruments and everything around you that you use during breastfeeding. We would prefer and would encourage you to wear a mask while breastfeeding the baby. This is just to ensure that the aerosols or droplets that you produce do not affect your baby. Next question. I am stressed. Will this affect my baby? What we do know is pregnancy in stressful situations has led to babies that are smaller in size than normal. This is long-term stress as opposed to just short periods of or short bursts of stress that the mother undergoes. Stress can induce preterm labor, and as previously mentioned, if the stress is for a long period of time, it can cause baby not to grow normally. My suggestion and what we advise our patients from the MP Shah obstetric team is do not stress. Take precautions to prevent getting the infection. Next question. My husband still goes to work. How do I protect myself? If your partner or husband goes to work, there are a few things you need to keep in mind. Number one, ensure he leaves the home healthy. Make sure he has his sanitizing gel. However, that is no substitute for hand washing with soap. When he arrives from work, make sure you open the door, not him. This is to prevent transmission of virus via the door handles. Make sure he does not touch anybody or anything inside the house and head straight for the bathroom. He should remove all his clothes and dispose them off in one corner to be washed again properly. He should take a full shower, right? And thereafter, he is okay to come into contact with you and the rest of your family. The other things you need to keep in mind is with regards to spreading the infection via coughing. You need to ensure that you use tissues every time somebody coughs nearby. That tissue, once coughed into, should be disposed of immediately. Next question. Should I attend my antenatal appointments? Antenatal appointments are rather important during pregnancy. What our team has decided is to reduce the amount of exposure between doctor and patient and other people, our population. We may reduce the numbers of antenatal appointments that you are required to make to hospital. Be assured we will ensure as much as we possibly can to make sure that your pregnancy is safe and you're undergoing a normal and healthy antenatal period. Please call our Waredi Center to ensure that you have not been forgotten and that your antenatal appointments are slotted for the safest period. What about postnatal appointments? We usually have 2 standard postnatal appointments after delivery. One is approximately 10 days to 2 weeks after delivery. This is to ensure that you're coping well with your baby and you're not having any abnormal symptoms. With regards to your 6 weeks postnatal checkup, we highly recommend again you call Waredi Center so that they can slot you an appointment at an appropriate time. Next question. What can I do to reduce my risk of catching coronavirus? WhatsApp and internet abound with the ways in which you should be taking care of yourself. Ideally, there is nothing special with regards to you and your pregnancy. Please make sure you avoid the virus at all costs. Hand washing, very, very important. With soap and water, at least 40 to 60 seconds every time you wash. Repeatedly keep washing your hands. Number 2, social distancing. What has been recognized is that social distancing reduces the numbers of people who get infected. Remember, this is a stealth virus. What does that mean? That means that the virus can be transmitted from a person with no symptoms whatsoever to the public around you. Ensure this does not happen. Social distancing helps. Make sure you have at least a 2-meter distance between yourself and the next person. These 2 are the current methods that are highly recommended. Wearing masks is one way, however, this is usually reserved for people who are in contact with very many other people during the day, okay? Or when they are in contact with somebody who is suspected to or is known to have the coronavirus infection. Please keep your questions and comments coming in. If there's anything we can do to help, please call the Waredi Center. We have somebody on call throughout this period to ensure that we as a hospital support your pregnancy.